Gustatory.
Gustatory. That's the fancy word. What about the eye?
Vision.
Vision. So it's visual. Okay. The nose.
Smell.
Smell. What's the fancy word for that?
Olfactory.
Olfactory. Very good. And hearing. The ear. Auditory. Very, very good. And finally, touch. Tactile. Tactile. Okay, so it's good if you can equate the words with the actual organ, okay? Because sometimes they give you the word and not the everyday word.
Right.
Okay. So sensory and perception, it's biology, it's physical, sometimes it may even be a little bit mental. If you are walking down the street and you smell something, it might remind you of something else.
Right.
If you hear a certain song, it might trigger a memory of
From
something
like 20 years ago.
else. Yes, absolutely. So it
Sometimes a
involves
good-
all of that.
Sometimes it's a good feeling, sometimes it's a terrible feeling.
So it could be either
Right.
either or. But if you take a cue from dogs, for example, when they're born with their eyes closed, because what's the most important thing for them?
Smell.
Smell.
Yeah.
That's what drives the dog is smell. Okay, for us it's more
Vision.
visual. Okay, so different creatures have different first senses because that's how they survive. Okay, so for us,
Like
our
snakes.
senses they're kind of muted. They
Right.
really are, because I don't think we pay enough attention to them. But if you ever did pay attention to them, like if you go outside right before it's gonna snow, you could smell the snow in the air if you really pay attention to it. You know, pay a little bit more attention to your senses, because those of us that are deprived of a sense, for example, maybe they're born blind, okay, but they learn very quickly how to navigate the world, okay, because their other senses become sharper. Okay, like their sense of where things are, the proprioception, that hearing becomes much more acute and prominent. Okay, so just kind of be aware of that. And even for those of us that as we age, you know, maybe, I don't know, maybe an elderly patient, their sense of smell diminishes, right? And that
Hearing,
could affect
or the
their appetite or their sense of hearing definitely diminishes, where they say to you, what? You
Yeah.
talk to me and you're walking away, I can't hear a word you're saying, right?
Yeah.
Because the sound is going in the other direction and their hearing is not as acute as it used to be.
Right.
Okay, so you may see that. You may also see that the older patient likes you to face them when you speak to them,
Because they read your lips.
because they're looking
Yeah.
at your mouth too. I know with the older folks in the advent of COVID and the wearing of the masks, they had a terrible time relating to us because all they saw was the eyes and they had no frame of reference with the mouth. They couldn't even try to lip read. So it was a little bit difficult for them. Okay. So we talk a little bit about normal sensation, what's normal reception, the stimulus of the nerve cell, and then how we perceive it, and then how we react to it. So you don't have to go crazy with this, but reaction is individual, okay? So if I hear a loud noise, and maybe that is a noxious stimuli to me, I might say, what the hell is that? And I'm gonna go and check it out, right? Meanwhile, somebody else might be like, yeah, who cares? And they just go about their business, right? So what do we call that?
Intuition.
Do you know what we call that? When you have different sounds and some of us react to them and some of us don't, it's a form of desensitization. Okay, so think about the nurse that's working in a hospital. The alarm is going off, the call bell is going off, somebody's shouting about something. A lot of times we kind of ignore all of it because we're so
Used to it.
used to it, but that's not good, because then you might hear something and you need to react to it, okay? So just kind of be mindful of that, all right? So some factors that affect our sensory stimulation, obviously we always talk about developmental considerations. The culture, what sound is important for what particular culture, okay? Personality, lifestyle, those of us like certain sounds because we find them pleasant. Other people ignore them, other people are like, oh God, you can't talk to, I don't wanna hear anything, you know, because they're getting sensory overload, okay? Medications can affect our senses. If you take too much of a medication, you might get a ringing of the ears as a side effect, that's gonna bother you, okay? You may take a different medication like a chemomed and you lose your sense of taste. That's awful. Think about if you have a bad respiratory infection and you lose your sense of taste, you really don't want to eat because eating and taste are very much intertwined, right?
Right.
Eating just satisfies the physical urge of hunger, but taste is what makes you enjoy the food. And if you have a bad head cold and you can't taste anything, you're not enjoying your food. Right, you were looking at me like you didn't really think about that. But it's true, it's definitely true. So there are disturbances in sensory perception, okay? So for example, a deficit, what is a deficit?
Something
Something
like
is there.
doesn't work.
Because either something is absent or something is impaired. So either the sense is not there, like vision or hearing, or it may be impaired. Okay, the patient can't see well in the evening, okay? The hearing is decreased, okay? So does that affect how they interact?
Yes.
Absolutely, okay? What about sensory overload? That can be very stressful.
Yes.
So what happens to most people if they have too much sensory stimulation? Think about the patient in the hospital. Are hospitals noisy places 24/7?
Yes.
They
Yes.
sure are. They're so noisy that patients sometimes have such a lack of quality of sleep that they actually get a little psychotic from lack of sleep. You know, if you sleep deprive somebody, they will become psychotic.
Yeah.
Because sleep is that important, okay? It's really very, very important. So much so that there are units that have instituted quiet times. So from say like, I don't know, 10 p.m. till 6 a.m., no noise on the unit, no noise. Okay, no people talking, no heavy carts rolling back and forth. They get rid of all but the most necessary stimuli. Why? So patients can sleep. And when I've worked evenings and sometimes done overtime on nights, if my patient was, okay, I didn't have to go in and check them every 5 seconds, I would say to them before they retired for the night, would you like me to close your door a little bit? So they don't get the ambient light from the hall, they don't get the extra noise, and they were like, oh my God, you're wonderful, no one has ever asked me that. Close the door, it's okay. I can go in and peek at them and be silent, but they're sleeping, I know they're okay, right? So again, that's something else, you're promoting rest, okay? So you're promoting accelerated healing. So sensory overload can be just as devastating as a sensory deficit, okay, for different reasons, okay? So again, some factors contributing to deficits, decreased stimuli. So what about the patient in the nursing home that maybe is a little confused and they never bring the patient out to the dining area to interact with anybody, so they're always in their room by themselves? That's a sensory deficit. They have no stimulation at all, okay, that's bad, that's very bad. And when somebody gets older, they get a little confused, right? So it's easy for them to, what?
Depressed.
Get very depressed, very depressed. Think about folks that, during COVID were used to going out, seeing people, talking to people, the older adult loves to see people, loves to talk to people. They don't know how to use the technology. Zoom was scary for them. People were seeing them from a distance, their eyes weren't good, they couldn't hear. So, that was terrible, that was a terrible time for them. So just be mindful of that as well, okay? So again, the selected nursing diagnoses and priority problems. Why do we always put these slides up? What did I tell you? Why this is important? That you should know. Priority
assess the
problems
patient.
with related to this. You could get a question on an exam, right? So you have to know how to connect the dots. So let's connect these dots, all right? So we're talking about planning, all right? We're planning for what? What are we planning for?
Are we gonna make them sleep better?
Okay. So first we have to come up with the priority problem. What's the priority problem? So let me go back, okay? Priority problem with regards to sensory or perception. I just gave you a whole bunch of them. I'm losing you.
Sensory deficit.
Sensory deficit,
Like
okay?
that,
So what is the sensory deficit? Tell me. Is
People
it
can't
vision? Is
hear or
it
see.
hearing?
impairment.
Is it, okay, so, okay, good. So then what would be your goal? They have a vision or a hearing
Safety.
deficit. Safety is definitely one of them.
How
You wanna
to
maintain
help-
safety. What else do you wanna do?
What treatments and plan that can help them see better, for example, with
Oh,
glasses or.
Good. How do they adapt to this?
To the- yeah.
Okay, so that we can provide them with the best quality of life possible. Okay, here's the priority problem. Now, what are we gonna do? This is the goal. How are we gonna get to the goal? So, what do we do? Okay, doing is our interventions. Okay, that's what we do as nurses with the patient. So you want to have them adapt to a sensory deficit, or you want to be able to somehow stimulate them in another way. So if they are visually impaired, what could you do? Get them glasses. What else could you do?
You can provide audio.
Yes, you can do audio, right?
Yeah.
If they are someone that used to be an avid reader, okay, and they like to read, but they can't see the print,
Bigger, make it printed
you
bigger.
can give them bigger prints. You can definitely do that. You can do an audio book, so now they're listening instead. See, we have to be creative. We have to think outside the box, and a lot of these things are not very costly to do, and it improves their quality of life. Am I making sense?
Yes.
Okay, so for vision, if they have a decreased vision and you as the nurse are walking into the patient's door in the nursing home, okay, what are you gonna do? Knock, make noise, announce yourself as you're coming in the room, okay, so because maybe they can't see too good, they can hear, so you can announce yourself, right? The large print, okay, so they can look at it. Pictures, okay,
Pictures.
maybe pictures are a little bit better than the words. Don't always think that you're gonna put somebody in front of a TV. You know, it's like a little kid or an adult. The TV's not the babysitter. You know, you can't just always put them in front of a television. talk to them, okay? Bring them out where there are other people, okay? Even if they're not directly interacting with them, they're just with other people,
Sitting or with.
right? It's like sometimes you'll see people, they walk, they go to the car, they go window shopping, they're just out with people. And then sometimes you get sick and you don't want people, so you know,